Hey, I think we are live. Cool. Well, welcome everyone to our second episode of Our Path Forward with Care Washington. I just want to start by reading a brief pitch about what our show is about. So it's been a crazy 4 years and an even crazier 2020, right? We're coming out of what is arguably the most racist administration in our nation's history, while going into our second year of surviving this pandemic. This is a moment in our nation's history like no other. And it has us all asking, what does our path forward look like? So to answer that question, or to at least ponder it, the team at Care Washington is holding weekly conversations on Facebook Live, where we can get together and think out loud together on topics like the continuing threat of white supremacy, getting the COVID vaccine and getting back to normal, whatever that looks like, and how we can continue to push our community's issues to the forefront now that Trump is gone. So this week, we're talking about the COVID pandemic 1 year later, our thoughts on the COVID vaccine, and the barriers and health disparities that many in our community are facing. Today, we are joined by our executive director, Imraan Siddiqi, and also happy to have Najma Osman, who is our youth and advocacy coordinator at Care Washington. Thank you both for joining us.
Thank you.
Thank you
for having us.
Awesome. All right, I'm gonna change my view on Zoom here really quick to speaker view. Also, there may be an interruption. I'm working from home, as we all are, so my husband might have to come in to change our son's diaper, but I'll make sure the camera is tilted so no one sees that. And we're going to be talking about working from home today, so that's probably a good lead in. So I actually wanted to start out with you, Najma. I wanted to talk a little bit about, we're a little past our 1 year anniversary with the COVID vaccine, or excuse me, the COVID pandemic, and working from home. It was a little over a year ago that we all started to hear the news about this new virus, and we all got sent home to work from home. And it was such a weird time, I remember, because you were hearing about this virus and we all thought, we were kind of waiting to see what other organizations did. Like we were looking at Microsoft, we were looking at Amazon and kind of these big corporations. And then also we were listening to our state leaders, like the governor, like the health department, about what we should do. And I remember some of the big corporations sent their employees home for like a week or two. And we were like, okay, we're gonna do the same. Let's follow their lead. Let's just be extra safe. And we all, it was kind of, at first it was fun. It was like, yay, work from home. We'll be back in like a week. I remember being like, oh, my plants will be fine. We just grabbed the stuff we needed. And yeah, I thought it would be a couple weeks. And here we are over a year later. And this is like weirdly become normal. It was really hard. Like last summer, personally, I had a really hard time like adjusting to it. And I was also pregnant and probably hormones were at play there. But this has become like, working from home has become the new normal. And like we've been running this organization from our homes. It's really weird. So I just wanted to ask you to talk about that time, I guess, and what it was like for you then, what you thought about it then when it was happening versus where we are now, and how you feel about it now.
Yeah, Jess, no, you kind of hit the nail on that. I remember us going home, and at the time there were only a few companies that were actually like, getting their workers to work from home. And so right. For the most part, there was definitely a sense of urgency and there was kind of like fear on it, but because most of the state and many other people were just kind of going to school, colleges were open, schools were open, and everything was kind of mostly normal. And so, we all had this thought that like, oh, we'll be back soon.
Yeah.
At first it was like, yeah, it'll be a couple weeks. And then we're like, oh, it'll be like a few months. And then it was like, okay, well, Ramadan's gonna be virtual, but that's okay. We'll be back in the office before summer. Summer is gonna be great.
Yeah.
And like you said, it's been a little over a year now, and it's crazy to see just how well we've adjusted. I think in the beginning, it was kind of scary. I think we were having like weekly meetings, like staff meetings, just talking about COVID and like doing the numbers and like updating, like, okay, there's this many cases. And in Seattle, like, I think we were kind of like the hot spot in the nation. So, it was kind of scary seeing people get ill and like seeing the elderly, especially in the very beginning, like dying of this disease. And now that it's been like a year and we've learned so much and have, through state mandates and everything, kind of hopefully with the vaccine and everything coming slowly, hoping to, get back to normal eventually at one point. But it's crazy how now, I think in the beginning it was always like, okay, I think there was always like a timestamp in terms of like when things would be normal again. But now it being over a year, I think like this is normal and this is like this is regular for us, right? So there isn't, like, I don't even anticipate things fully ever going back to the way they were, but also trying to be very positive. But I think as an organization, we've done so much, and especially in the very beginning, we were a really good like resource, and we were very like on the spot and providing very essential information. And so we were able to kind of run things, I would even say even like more efficient than we were doing before, because of the urgency and because of the community need and concern at the time. So
yeah, it's been wild. I miss, like, I went into the office once and all my plants were dead. And there was like cookies and like some dates and like snacks left over from when we left. And I don't know, it's just sad. I miss it. Like, I am happy to work from home. I'm privileged to work from home, but I miss so much. And for those who don't know, our office is downtown Seattle on 3rd and like Pike or Pine. I always forget. I've lived here over a decade. So it's downtown, it's in the middle of everything. There's a lot of life. I really miss our doorman, Gil. Like, every morning, I would talk to him, and like he was going to come to my wedding. Like, I developed like a close relationship with our doorman, and I miss most, of course, like seeing you guys, in person. Like, we've maintained really close relationships in spite of the fact that we don't get to see each other in person and we're all digital. Like, I still feel really close to you guys, but I definitely miss it. But also very happy to be able to work from home. Like, really proud of like that we've been able to do such good work from home. My husband's a locksmith, and he doesn't get to work from home, of course. Like, he's had to work this whole time. So yeah, I remember too, we were all worried. The board was worried that we might not be able to work from home, like, and be successful at that. Suddenly everything went to digital programming. We were in Zoom meetings all day for the first time, and we weren't able to see each other at the office every day, or we weren't able to go to Juma on Friday or go to community events. And everything just shifted to like this digital world that was really new. All of us had worked from home maybe 1 or 2 days a week, or had done stuff from home, but we had never ran a civil rights and advocacy nonprofit from our homes. You talked a little bit about this, but can you talk a little bit about how that was such a crazy time, thinking about like how we were going to run the organization and do the work that we do, and how we've really adapted and adjusted as a team to now running this organization from home?
Yeah, I remember, we had events planned in the spring, and then like just so much like Ramadan, like themed things, and like very much like community gatherings, and that's kind of how we do a lot of our events. And then having to cancel that, I remember like in the beginning kind of being a little anxious because, you know, we had all these plans for 2020 and then we kind of had to scratch it. But I think with our team, we were very successful in being innovative and using technology to the best of our capacity and to the best of our ability. We had webinars like I think weekly, and they weren't just like, you know, informative and like educational webinars, but also like things that were very much what the community needed, right? A lot of folks had questions about the PPP loan and how that works, and we had a webinar on that, and there was like census programming that was like a really big project of ours for 2020. And we still had multiple webinars talking about the importance of civic engagement and census. And because it was a virtual format, we were able to still get really great speakers. And so I think we were able to, apologies if you hear a little bit of noise,
Okay.
siblings, live with a bunch of family, you know, alhamdulillah. But so we were able to, I think, maximize our efficiency working from home, and we were able to use digital outreach and digital means of communication to the best of our ability. And I think we did a really, really good job on that. And we didn't really like take a beat, you know, we didn't really pause. We just kind of went full forward. I think we started like our programming in early April, if not March, you know, like a few weeks, probably less than a month of like,
we
when we were working from home,
right
we took off and we just kind of went running. And I think that was a really good strategy of ours because of course, like through that, we've learned a lot on the way. And now being a year down the line, we're really good at this, you know, and we're able to put on events that are just like amazing. And it's because we were able to just start and then learn from our mistakes as we go. So, and I think we also have just amazing fan base and a great amount of supporters that push us along as well.
We do. It was so great to see, like, I don't know why you kind of feel like you're going to not lose people, but like lose them in the short term and like lose touch and like, but as we transition to this online world, of course, everyone else was. And yeah, like our community and our supporters and like kind of our larger network has just been there with us the whole time. And it doesn't feel like we've lost our connections to each other either. You know, they're different, but we're still all connected. And I think it's interesting you use the word efficiency, which is something we've talked a lot about and we're very proud of, that we've actually been really efficient. And like in terms of our output, like we feel like maybe we're more efficient working from home and like outputting more. And Katie, who is our media coordinator, she's running the tech right now, she said to me the other day, because I was saying like, how cool is that? And she was like, yeah, but there's got to be a downside to that, right? Like, what is the cost of that? And on that note, we're going to be having Noor, who is our programs and operations manager. She's going to be joining us in a couple of weeks to talk about Zoom fatigue and like boundary setting and how we're navigating those challenges as an organization, because this is something that is impacting, I think, a lot of people. So more to come on that. But a question for both of you, we'll start with Imraan since he's been kind of left out so far, is what is your least favorite part of, well, actually, I'm going to back it up. I have a question for Imraan that, because, you know, he wasn't with us for the whole year, but you've been with us for almost half a year during this whole COVID pandemic. And not only that, but you had to transition from being an executive director of CARE Arizona to taking on becoming executive director of CARE Washington while we're all working from home, and you did this all, you know, remotely and digitally. What was that like?
Yeah, it's very rarely that I don't get to talk a lot, so no problems. It's good, always good to hear you all speak ahead of me. So yeah, it was definitely a challenge. I think from some perspectives, I sat back and was watching the great work that CARE Washington was doing, because this was really where things were hitting first initially in the country. And you all really sort of set the tempo, I think, for other chapters in terms of how to spring into action. Like that's always a concern, I think, when in the beginning, and it may still be happening in the corporate world, like people were saying that, okay, we need to, take attendance and like, make sure that people are, at their desks, and we want to make sure that you're wearing shoes like at your desk and so on and so forth. And it was micromanaging, like not putting faith in your actual employees, which is to your detriment. And what you see like with the staff, like they're very determined, and like they love their work and they wanted to jump into it and really find solutions for the community. So just jumping in and seeing how you all did that, I think was really inspiring. Like Care Washington wasn't really set up for this type of pandemic happening, but like just because we have such a big standing in the community and we have such a big audience, like we had to step in and be that source of information for the community. So it was really admirable to see that. So from my side, like Najma said, it was just sort of like a cloud coming in. Like you thought it was going to be maybe a couple of days or a couple of weeks, and then you step away and you haven't been back for a year. So it was really uncertain in the beginning time frame. Even in Arizona, I think we were thinking maybe it was going to be a couple of weeks, but then you start seeing just like the numbers spiking up, this country more than others. And, I've lost people that I was friends with to this pandemic, and had loved ones get sick and so on and so forth. So it's been a very difficult time frame just to see, how this is taking shape over here. But this has hit us very uniquely in terms of across the country. But it's also been, there's, with every like negative situation, there's always blessings that are involved. And so we always try to look at the positive. Like you always want more time with your family. You at the end of your life, you're not going to look back and say like, okay, I wish I was, out there doing, like hanging out with people or playing more video games or being at the office more. It's about like your family and all that. So having like family here, on a day-to-day basis, we adjusted quickly to the whole remote situation. And, I have 3 sons and they're all going to school, and having to compete for bandwidth and all that type of stuff was a little bit difficult. But just being there, and like, you started like figuring out more creative ways to like spend time together. Like we would go walking every day, in the evenings, and just try to like, cook together, learning new skills and things like that. So it's been a blessing from that side. From on the flip side, it's always a challenge, having 5 people in a household and having one internet connection. So, we're glitching out every now and then. People screaming in the background, as Najma just pointed out. My kids were just screaming upstairs, so I'm sure you've heard a little bit of feedback.
I got a baby, he's gonna need a diaper change here in a second.
Yeah, but also it like redefines like what you see as a workplace. Like me as a boss, I'm not like, wow, what, this is so unprofessional or whatever. This is just the reality that we live in, and we're still productive and we're still like successful in doing this work, even though we have to deal with like these other challenges. So it just shows that we have like this resiliency and this ability to evolve. And I think that's been the case with, our entire community and our organization as well.
Yeah. For those of you who might just be joining us on Facebook Live, this is Care Washington's Our Path Forward series, and we would love to have your comments or questions. So if you have any comments or questions, please put them in the comments, and Katie will get them to us, and we'll try to answer them during this live session. We're talking with Imraan Siddiqi, who's our Executive Director at Care Washington, and Najma Osman, who is our Youth and Advocacy Coordinator. So Imraan, you actually just did a great segue into our next question, talking about working from home. And we'll start with you. What is your favorite part and your least favorite part about working from home?
Favorite part is, not having to commute. I'm out here in Sammamish, so if I had to commute every day, it would be probably a 45-minute to an hour drive for me. So I'm relishing that aspect during this time. Least favorite, obviously, is I haven't met any of my coworkers in person, so that's a challenge. I never thought I would be saying that. We see each other so frequently every day in our day-to-day interactions, and we're always in touch with each other. So we we all like each other, thankfully. So it's a positive thing as well. But just not being able to like interact or, you know, take the staff out for lunch or whatever, you know, bring coffee for folks, like that's a challenge. It's just something you have to deal with. So, you know, that's probably the least favorite part, but you got to deal with it.
What about you, Najma?
Yeah, very similar answers. Yeah, I was gonna say the same thing about not having to commute, specifically like not having to like go on the bus when it's like dark at that shady street
That's
coming
true.
back home. So that, you know, not having to commute is a blessing. And I think I'm really grateful that we have like the privilege of like working from home. And the least favorite, honestly, I really miss like our conversations at the office, and just like getting to talk to each other on like a daily basis, and like seeing each other. You know, we see each other virtually, but it's
Right.
just, it's not the same.
Right.
You know, just casually going out for lunch and just talking about things. That's something I miss, I think. Yeah, being able to like see people and like socially interact with them outside of the digital means. So
It's like with Zoom, or with the way it is now, everything is intentional and timed, is the way I'm thinking about it. Like, whereas when you're in person, there's just kind of these open, casual spaces and time where you can have interactions with people. I thought, like, how can we recreate that at home? Like, what, you're just gonna have your Zoom on all the time and like be eating, and then I look over and I'm like, hey Najma, what's up? Like, you know, what are you eating? Like, you can't do it. You can't recreate it. So that's just what it is.
yeah.
It's interesting to think about. Yeah. Yeah, I saw someone say, like, are we working from home or are we living at work?
Yeah. Yeah.
The things that I like the most are also the things that I like the least, which is like, I love being able to get up and like use my restroom or go to my fridge and eat my snacks. But at the same time, what I don't like is there's no work-life separation. I mean, there is, like, at the end of the day, I try really hard to be done, shut down my computer, but it's still like I don't leave my house to go to work, which I really miss.
Yeah, absolutely. I think like there's that having to figure out like boundaries and like, you know, not like overworking yourself, and just like, yeah, especially during the like beginning of the pandemic, like that was something that I think so many people were trying to maneuver. Because in the beginning, it's like, oh, I just have to open a computer. Like I don't have to physically go anywhere. But it's like you have to like train yourself to kind of be disciplined in a way, so that like, you know, you're comfortable, like you don't need to be wearing, you know, formal clothing or business casual, but still trying to like make sure that you're not like overworking yourself, and you know, you still have to have structure.
Yes.
So like that's like a balance.
You got to make the structure. Yeah. So interesting. I want to read some audience answers to one of our polls, or one of the questions that we posed on our social media from last week's show. We asked people on Instagram, we asked them, what are you most looking forward to doing once things return to the new normal? And I want to read some of the responses that we got from people. I'm going to read it off this sheet of paper. So we asked people on Instagram, what are you most looking forward to doing once things return to the new normal? And this is from Mustafa. Hi, Mustafa, if you're watching down in Olympia. Mustafa said that he's most looking forward to restarting our signature, much celebrated, very effective monthly First Friday open house program series that they had there at the Islamic Center of Olympia, Masjid al-Nur, for engagement, advocacy, and outreach in the state capital as well, inshallah. So Mustafa, good job plugging the program there at the Masjid in Olympia. This answer is from Ashraf, I'm sorry if I'm saying that wrong. They said they are most looking forward to Eid prayers. We have another answer here from Lori. She said that she got her first Pfizer vaccine and her arm has been swollen for a week, and that she is hoping to help get back to health again and to create a world where people thrive again in a safe and harmonious community. That's from Lori. This is from Jess. She said she's most looking forward to eating out and going to the movies. I am. And then Brianna said, I can't wait to hug again and to be able to cook for each other. I never realized how much of my life resolved around making and sharing food with people in my life and community until I couldn't this year. Very true. So those are just some of the answers we got. What are you guys most looking forward to doing?
For me, I think just, being new to the community, getting out there and meeting community members. I feel like sort of behind on the curve of that. There's obviously like some socially distanced Friday prayers, of course, and things like that are happening, but it's not really a space right now where you can go and socialize with folks, or it's sort of this really abbreviated time frame. But inshallah, as things get better, then getting out there, having people over to the house and meeting people in different communities throughout the state of Washington. And then also, I think just looking forward to see like how, as a workplace and as a society, we evolve, knowing that we can be very productive in these remote settings. So like maybe, things don't need to go back to the old sort of normal archetype that we used to have. And maybe we can, be a little bit more flexible in terms of like these types of options for folks where they're not having to go into an office every day.
Yeah, definitely. Cool. Najma, what about you? What are you most looking forward to?
Honestly, I'm most looking forward to being able to travel again. I remember in 2020, there was like a couple of trips that I had planned out that unfortunately had to be canceled. So I'm looking forward to just like, being able to do adventures and be able to like enjoy the world. So
Yeah, I feel like we're all gonna, once we can, we're all just gonna start like taking vacations and trips and going to the beach and all that stuff. I just want to have a barbecue at the park. Like, I just want to have a barbecue, some hamburgers and hot dogs, and all the little things I miss. Well, I want to shift the conversation now to talking a bit more about the COVID vaccine and health disparities and some of these issues that we've seen exacerbated for our community, for other communities during COVID-19. And I want to start out by asking Imraan, if you could talk a bit about some of the existing health disparities and how you've seen them exacerbated during COVID-19.
Yeah, these are great questions. Just, I think that's something that we as a community just have to always be cognizant of, is that we talk about these different struggles that we as individuals deal with on a daily basis, but we have to constantly think about where these disparities exist in society. And thankfully, I mean, we live in a place, and I always say that, I think on every single broadcast or webinar that we do, we live in a place where there's like a little bit more thought and intentionality going into trying to rectify some of these solutions. But if you look at, let's say, communities of color, for example, like, language barriers that exist in terms of getting out there, and like there's been lots of different options in terms of like aid and like stimulus and housing moratoriums that have existed out there, but a lot of times, like new Americans, for example, refugees, people who English is not a first language, they're not receiving the same information, and they're dealing sometimes more amplified with a state of duress when it comes to like the financial strain that comes to them when it comes to like dealing with this pandemic. Like, am I going to be able to make rent this month? Do I have an option to like, maybe delay my payment until things sort of get better? And so those are some of the things that exist out there just in general, like the carceral system, in terms of just we always need to think, as a Muslim community and beyond, like we have brothers and sisters who are incarcerated in local, state, and federal systems, and how have they been impacted by this pandemic? We're dealing with this type of situation where you have the luxury of socially distancing a lot of times, but if you're in a prison, for example, then these types of pandemics get exacerbated, and we've seen it like time after time across the country where it's been spreading by wildfire amongst inmate populations. So what is being done to address that aspect? We had situations where even locally, where 6 Muslim men were sent back to a prison facility for some trumped up charges. I think that was last June with the Department of Corrections, and they were called the Reynolds Six, and that's concerning. Like, so these types of issues, they impact our communities up close, and we don't think about it a lot of times. Like as community members, we're sort of just going about our life, but we also always have to be thinking about like, how are our communities being affected by the criminal justice system, the inequities that are exacerbated over there. Disproportionately, Black people are affected by these types of infractions as well. So these are things that we have to think about as a community.
Definitely, thank you. I just want to say really quick for anyone who might just be joining us, this is our path forward with Care Washington. It's basically a series that we're doing on Facebook Live where we're having conversations about current issues and where we're at as an organization, where we're at as a community, and the work that we're doing at Care Washington. And we really do want these to be conversational. So we would love to hear your comments or questions. You can post them below in the comments, or you can always email us. And we're doing these weekly on Thursdays at 3 on Facebook Live. So we're talking right now with Imraan Siddiqi, our executive director, about some of the existing health disparities that are out there and how they've been exacerbated during COVID-19. Imraan, could you talk a bit about some of the work that we've done here at Care Washington to try to bridge some of those existing gaps for our community in regard to access to healthcare or access to information about COVID-19, resources to help people out during COVID-19, that sort of thing?
Yeah, it's like I mentioned, Care Washington was an example for other care chapters that were out there even before I started. So just really giving you all a shout out in terms of how you executed on these things. But like doing these COVID resource seminars early on in the process, like keeping people updated in terms of like what the numbers are, like what resources are there. I saw that from like the very beginning. So that's Care Washington springing into action as soon as it happened, because those types of everybody was sort of scrambling like in that beginning phase, but Care Washington really just like they were steadfast and they stood strong, and they were really like that front line for the community. So really props on that. But it's been something that's been ongoing even since I've started over here as well. Like it's regardless of our day-to-day stuff is obviously the civil rights and advocacy, but part of advocacy is ensuring that public health in our community is protected as well, and people who are speaking all different languages. So we produce materials on multiple instances in terms of like the housing moratorium, for example, with Washington State, making sure that we're producing translated videos in like Somali, Oromo, Cham, and some other languages as well, making sure that we have some access from the community to see that what is available to them. We're continuing to do that. I mean, it's not only just us producing the work. We have partners, for example, that we've like tightened our relationships with over the course of the past year. Like let's say the Somali Health Board, they've been a true champion for the community when it comes to like public health and ensuring that the community is getting vaccinated. So we've partnered with them on a number of programs, and like whether it was them speaking at our Muslim Days at the Capitol, like educating people on these health disparities, doing joint webinars and things like that. And we've also built strong relationships on a state level as well in terms of like becoming a trusted partner with like the city of Seattle, like Washington State, and so on and so forth. So these are just things that building, like nobody's going to be able to go at this alone and work on it alone. So having community partners that we're working alongside with, having like city partners, state partners that we can, get these resources from and like ensure that they're being passed down through the right channels to our community. That's really what's important. So, once again, props to the team for really holding this up during this time.
Thank you, Imraan. Yeah, I want to kind of ask Najma a similar question. Najma, I know that you've been doing some work around this as well in terms of working with community members to understand like what the barriers are that are existing around the COVID vaccine and like resources during COVID. Can you talk a bit about, I just lost my question. Can you talk a bit about the work you've been doing and how Care Washington is working with partners to address some of those health disparities and specifically for our community?
Yeah, I've been having conversations with community members and, hosting a focus group and just doing research on COVID's impact and how COVID has exacerbated health disparities, specifically in like minority communities, right? And through these conversations, we've learned a lot, but really that there's a need for intentional outreach for, these specific communities, right? There needs to be a trust building effort and communities that are, communities of color and organizations that are mostly like BIPOC led leading this kind of work. And with our, Imraan mentioned Somali Health Board, for example, being a really good resource locally that is doing that work. And we're also partnering, we've partnered with the Office of Immigrant and Refugee Affairs to kind of help bridge that gap, right? And make sure that communities of color are getting access to the vaccine and that there's intentional outreach to those communities directly because there is a disproportionate effect of COVID-19 on communities of color. And so with our partnership, we are intentionally kind of bridging that gap by providing access for the vaccine. So that's kind of some of the work that we're doing. And yeah, I think Imraan kind of hit the nail on everything, but really just pushing for intentional outreach to those communities is really imperative.
Thank you, Najma. Let's talk a little more about the COVID vaccine. We asked our viewers a second question last week, and we asked them on Instagram if they are planning on getting the COVID vaccine. And we actually got over 20 responses, which is pretty good for an Instagram poll. And 91% of people who responded, so 20 people said that yes, they are getting the COVID vaccine. We had 2 people respond and say, no, they're not planning on getting the COVID vaccine. What about the 2 of you? Are you planning on getting the COVID vaccine if you haven't already?
Yeah, definitely. Coming from Arizona, my parents are in sort of the older demographic, and so that was one of our major concerns when the pandemic hit. It affected all of our interactions on a day-to-day basis because they lived in a different household than me. All my aunts and uncles and folks in the family were sort of in that older demographic, and so you really think about the folks in your family that are most vulnerable. And thankfully, the folks in Arizona, my parents got the vaccination, both phases, didn't have any side effects or anything like that, no aftermath sickness. So that's great for them. When my time comes up, we're a little bit lower on the totem pole in terms of like what group we're in, but once it comes up, I'm definitely gonna get vaccinated, and hopefully it continues to roll out soon.
Same, honestly. Like, I am really excited and can't wait until it's my turn to get the vaccine. So I'm just kind of twiddling my thumbs, trying to be patient until it's my turn. But I'm very excited to do so.
Me too. Same with what both you said. I'm chomping at the bit, so I'm very excited. Seems like the supply's gone way up, so that's great. Still there are concerns out there about the vaccine, about, you know, the speed at which it was produced, about the newness of the vaccine. And we also know that there's a lot of misinformation out there, especially, you know, on the internet. What have the two of you been hearing about, and what are your thoughts about maybe some of the hesitancy that is out there for some people about the vaccine? I know, you know, my family, we don't have to talk too much about my family, but my dad, we were talking about the vaccine. He was sharing some concerns about, there was a story of like some older guy who had gotten the vaccine and like a week later he passed away. And I was trying to say, you know, well, correlation doesn't equal causation, but there's these kind of stories out there, even if there's no evidence to them about them being connected to the vaccine or anything. You know, people have their fears. What are you guys hearing anything about that? Do you have any thoughts about how some people may be hesitant to get the vaccine?
I mean,
Yeah.
thankfully, oh, go ahead.
Oh, sorry, no, go ahead.
I'll just quickly say, yeah, just like I think a lot of the misinformation, you know, being somebody who's very active on social media, I think it's just something like we create our own echo chamber sometimes where and this happens in the Muslim community also. So we're not immune from these types of things happening, but you start sort of showing what your interests are and what your likes are, and you sort of form a thought bubble around you on social media, so you don't really have a sense of like, you know, what the true facts are out there. And that's happened a lot in this age, you know, especially places like Facebook where the algorithms are incentivizing like wrong information and so on and so forth. Twitter historically has done that as well. But, you know, it's something that's a public safety concern. I know that there's a whole anti-vax movement that's out there, but it's dangerous. I mean, anti-vax like on stuff like measles and smallpox and stuff like that. These are things that have been like eradicated like years and years ago. Like why would you not do it? Like you have to think about the greater good of society in order to do that. And we have to be smart about it. Like some folks were not wearing, you know, there's still folks that are not wearing masks out there, and like you still start seeing these little flare-ups of, you know, the virus happening because we're so stubborn in doing that. So really, you know, putting political sort of affiliations aside, like this is something that's good for you know, society. Like, I mean, my own family has all been vaccinated. They've had no side effects. So that just speaks to the effectiveness of what's happened so far. So really, I think, you know, trusting your sources, like finding like trustworthy sources is important, not just ones that reinforce your political biases and things like that. I mean, this is something where science is going to be extremely important. And, you know, as a Muslim community, we embrace like scientific, you know, these scientific aspects. So it's important to just like know the sources where you're reading this information. Don't spread misinformation also. That's important also.
Yeah, and I think a lot of these things that even like my dad shared with me or things that I see, it's like, it's anecdotal, or you don't know like what the source is. It's like an anecdotal evidence or like a story versus looking at hard research evidence from the CDC or from WHO or from, you know, these different researchers that tested and did research and studies on the vaccine. So yeah, thank you, Imraan. Najma?
Yeah, Imraan talked about misinformation, and that is definitely huge, right? There are a lot of false information being spread on WhatsApp groups and you know, other social media platforms, and so I can't emphasize this enough, but you know, there are people in the community that are trusted. There are people, obviously none of us are medical professionals, but you know, talk to your doctor, talk to those you trust, who are educated on this subject, and learn, right? And do the research. There is a lot of misinformation, but there's also a lot of distrust that is kind of beyond the surface of just misinformation, right? There's a long history of structural violence and racism in this country. And there are people who have had experiences with systemic racism, specifically, in the medical setting, right? And so it's important that we understand that there are a lot of layers to this, right?
Yeah.
And there are so many communities who have been hurt in the past and who, for very reasonable reasons, they have distrust, right? And so it's important that there are efforts that are looking to, when people are doing outreach to communities of color and historically marginalized communities, that there's intention behind it, and that there's an effort to restore that trust, because their mistrust is not misplaced, and it should not be looked down upon. They have good reason to be doubtful and to be worried and to have these questions. And so having questions and having concerns and having hesitancy is not a bad thing at all.
Yeah.
It's important that when we're navigating this and when we're approaching this, that we are very mindful and intentional with the way we do things. So definitely talk to your local leader, whoever you trust, whether that's your doctor or, amazing organizations like the Somali Health Board or your imam. There are so many different religious leaders that are also talking about this. If that is your trusted source, go to them and talk about this. But make sure that you have the information, the full picture, before you draw up any conclusions. But like I said again, we're not health professionals, so make sure you're looking at a trusted source.
Thank you for that, Najma. That's really, really important context and perspective. So I appreciate that. Great. Well, I think that was my last question, and we're just past we almost did 45 minutes. We almost got within our timeline here. So next week, our show next week, I want to talk about that. We're going to be having Brianna O'Fray. I hope I said your name right, Brianna. Please don't kill me. Brianna is our legal and policy manager, and she's also our staff attorney, and she specializes in civil rights, but also immigration rights. And we're going to be talking a bit about the growth of our legal and policy teams at CARE Washington. We're going to be talking about our Immigrant Rights Center and how we're really expanding the work that we're doing, providing immigration assistance for folks in our community. And on that topic, I want to we're going to post this question in the comments too, but we have a question for our viewers, and we're going to be sharing your responses to this question during next week's episode. And the question, I have it here on my phone. The question we want to pose is, we all have unalienable rights granted to us by the US Constitution. What is one right that you want to know more about? So if you can answer that question, you can comment below. We're also going to be posting it on our social media, and we would love to hear your answers, and we will share them during next week's episode. So I really appreciate both of you being here today. It was a really good conversation. These are just great. This is our second time doing this, and I hope people watching find it enriching or something of value here. I'm personally finding a lot of value in just having these conversations with my team members, and I'm enjoying it. And I was just thinking, as Najma was talking, we should really do an episode on misinformation. And that's a whole conversation, but misinformation on social media, talking about, WhatsApp, and then just kind of the history of misinformation. I think that would be a really good conversation, because it touches every community. It touches my community, where I come from. It touches, people Najma knows. It touches everyone. So it's really prevalent.
For
Any
sure.
final thoughts or comments or questions from the two of you?
No, I like the direction where things are going with the conversations. Hopefully this is giving a little bit of a glimpse deeper into our team as well. We have a deep squad here at CARE Washington, so want to give everybody a chance to show up and show just how brilliant of a team we have. So thanks once again.
Thank you, Imraan. Any final thoughts, Najma?
No, this is a really cool conversation. So I'm happy to be part of it. So thank you for inviting me.
Cool. All right. Well, thank you so much, and we'll see everyone else next week.
All right, bye.